Hello, my name is Emily Lester, and today I want to tell you why every baby should be breastfed until the age of 6 months if they are able to breastfeed. If a multinational company developed a product that was nutritionally balanced and a delicious food, a wonder drug that both prevented and treated disease, cost almost nothing to produce, and could be delivered in quantities controlled by the consumer's needs, the very announcement of their find would send their shares rocketing to the top of the stock market. The scientists who developed the product would win prizes, and wealth and influence of everyone involved would increase dramatically. Women have been producing such a miraculous substance, breast milk, since the beginning of human existence. Gabrielle Palmer made this statement in her book, The Politics of Breastfeeding. Breastfeeding is imperative to the health of all babies who are capable of digesting breast milk. There is no reason that most babies should not be breastfed. The American Academy of Pediatrics makes the following recommendation. The AAP recommends that babies be exclusively breastfed for about the first 6 months of life. It means your baby needs no additional food except vitamin D or fluids unless medically indicated. Babies should continue to breastfeed for a year and for as long as mutually desired by the mother and baby. Breastfeeding should be supported by your physician as long as it is the right choice for you and your baby. Today I will inform you of the reasons why every capable baby should be breastfed for at least 6 months. How breast milk prevents disease, how breastfeeding costs less, and how most mothers can breastfeed. Breastfeeding is economical, is both healthy for the mother and baby, and additionally, it is a natural option and should always be considered. According to the Healthy People 2010 initiative set forth by the United States government, in 1998, only 64% of mothers were breastfeeding in early postpartum. At age 6 months, only 29% of babies were breastfed. And at age 1 year, only 16% of babies were breastfed. These statistics are disturbing, and a change needs to be made to protect our future babies. Education and support are the only way that these statistics will change. Mothers and fathers, past and future, need to be educated on the benefits of breastfeeding in order for breastfeeding to become more prominent in our society. According to the California Department of Health, some barriers to breastfeeding are lack of knowledge about breastfeeding among healthcare professionals, lack of knowledge about breastfeeding among the general population, lack of consistent and accurate information about breastfeeding, hospital practices which are not supportive of breastfeeding. These include formula discharge packets, supporting formula, hospital feeding schedules, early discharge, and unavailability of rooming in. Lack of a support network during the critical postpartum period. Psychological barriers, including misconceptions, negative attitudes, lack of confidence, and lack of support in the workplace. Cultural barriers, including sexual connotations associated with the breast and or lack of role models or family support. And the ready availability and conspicuous display of infant formula and formula advertising in hospitals and public health programs. These barriers are easily overcome with proper education. If we offer education to all socioeconomic backgrounds, it is an understandable way that more parents will be willing to breastfeed. As Gabrielle Palmer stated in her vision, education would be the first step in the promotion of breastfeeding and the enhancing wealth of the world. Breast milk prevents disease in infancy due to the antibodies that are in the mother's milk. Many people do not know that breast milk has also been shown to prevent some childhood and adult illnesses, including obesity and diabetes. The Leche League states, breastfeeding has been shown to be protective against many illnesses, including painful ear infections, upper and lower respiratory ailments, allergies, intestinal disorders, colds, viruses, staph, strep, and E. coli infections, diabetes, juvenile rheumatoid arthritis, many childhood cancers, meningitis, pneumonia, urinary tract infections, salmonella, sudden infant death syndrome, as well as lifetime protection from Crohn's disease, ulcerative colitis, some lymphomas, insulin-dependent diabetes, and for girls, breast and ovarian cancer. UNICEF also promotes GOBI, growth, oral hydration, breastfeeding, and immunization as the 4 principles of childhood survival. Mothers who choose to breastfeed also reap the benefits. They lose their pregnancy weight faster and have lower rates of osteoporosis and breast, cervical, and ovarian cancers. Breastfeeding every capable infant could save individuals and taxpayers a substantial amount of money. Breastfeeding is very low cost compared to the cost of feeding baby formula. According to the California Department of Health, the cost savings of breastfeeding due to the reduction of illness, associated medical visits, and hospitalization for infants and their mothers are important for healthcare programs. It has been estimated that 2 to 4 billion healthcare dollars could be saved annually in the United States if all women breastfed their infants for as little as 12 weeks. This estimation of savings does not include money saved by families by not buying artificial baby milk, nor the cost of savings related to the environmental savings of breastfeeding. Looking only at ear infections, infants who are exclusively breastfed for at least 4 months are half as likely as artificially fed infants to have ear infections during the first year of life. Fewer visits to the physicians for ear infections offer tremendous savings in time, money, and emotional trauma for families and the healthcare system. Most every mother is capable of breastfeeding. The reason that most mothers fail at breastfeeding is lack of proper education and support. The nurses at the hospital are usually poorly trained on breastfeeding, and certified lactation consultants can be hard to find and expensive. Proper education before the baby is born is imperative, and we should be offering more resources for our new moms. According to the International Breastfeeding Journal, Arnold states that these 10 steps can make breastfeeding successful. Have a written breastfeeding policy that is routinely communicated to all healthcare staff. Train all healthcare staff in necessary skills to implement the policy. Inform all pregnant women about the benefits and management of breastfeeding. Help all mothers initiate breastfeeding within the first hour after birth. Show mothers how to breastfeed and maintain lactation even if separated from their infants. Give newborn infants no additional food or drink unless medically indicated. Practice rooming in. Allow mothers and infants to stay together 24 hours a day. Encourage breastfeeding on demand. Give no artificial teats or pacifiers. Foster the establishment of breastfeeding support groups and refer mothers to them upon discharge. Strong evidence supporting the need for babies to receive breast milk as long as they are able is evident. Breast milk provides complete nutrition, is economical, and most mothers can do it with proper education and support. The bottom line is, breast milk is best for your baby.